would you do when someone falls unconscious in front of you? Yes, it's really a frightening situation. How would you lend a helping hand? Let's see. A warm welcome to another episode of ARMEDICOs. I'm Sabiha Munir, and today we're here to deal with one of the most relevant topics and something every one of us needs to be aware of. CPR. What is CPR? You all might have probably heard or seen in movies. But what is it exactly? CPR or cardiopulmonary resuscitation. It is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR given can double or triple the chances of survival after cardiac arrest. Now, what is cardiac arrest? A cardiac arrest is caused by an electrical problem in the heart. This electrical problem causes the heart to stop pumping blood around the body and to the brain. It causes the person to fall unconscious and stop breathing. Without CPR, the person will die within minutes. CPR is actually unlikely to restart the heart alone. Its main purpose is to restore the partial flow of blood to brain and heart. The main objective is to delay tissue death. Now, why CPR? A human brain can survive for only an average of like 5 minutes without oxygen before it becomes permanently damaged. When used properly, CPR can dramatically increase a person's chances of making a full and complete recovery, even after a serious injury or problem. Simply allowing a person to lie still while waiting for help can increase their risk significantly. Also, CPR is a way to take a proactive approach to a frightening and stressful situation. It is one of the easiest things you can learn that can make a true difference in another person's life. Now, when to give CPR? CPR is given when the person is unconscious and not breathing, or unconscious and not breathing normally. In case of children and infants, use CPR when they are not breathing normally and not responding. Now let's look at this. What will happen if their heart is beating but they are not breathing? This is called a respiratory arrest, and it will become a cardiac arrest quickly without CPR. So don't waste your time checking for a pulse. If someone is unresponsive and not breathing or not breathing normally, then call the emergency number in your locality and start CPR. CPR is done mainly in 2 stages, the preparation stage and the CPR stage. Let's start with the preparation steps. First, check the scene for factors that could put you in danger, such as traffic, fire, etc. Next, check the person. Do they need help? Tap their shoulder and shout, "Are you okay?" If they are not responding, call the emergency number in your locality or ask a bystander to do it before performing CPR. Step 2. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouth and check for any obstruction, such as food or vomit. Remove any obstruction if it is loose. If it is not loose, trying to grasp it may push it farther into the airway. Step 3. Check for breathing. Place your ear next to the person's mouth and listen for no more than 10 seconds. If you do not hear breathing or you only hear occasional gasps, begin CPR. Now, the CPR stage. Perform 30 chest compressions. Place one of your hands on top of the other and clasp them together. With the heel of the hands and straight elbows, push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress their chest at a rate of at least 100 times per minute. Let the chest rise fully between compressions. Next, perform 2 rescue breaths, making sure their mouth is clear. Tilt their head back slightly and lift their chin. Pinch their nose shut. Place your mouth fully over theirs and blow to make their chest rise. If their chest does not rise with the first breath, retilt their head. If their chest still does not rise with a second breath, the person might be choking. Next step is repeat. Repeat the cycle of 30 chest compressions and 2 rescue breaths until the person starts breathing or help arrives. How long should I continue CPR? Always call the emergency number before starting CPR as said earlier. Then keep doing CPR until professional help arrives and takes over, or the person starts to show signs of regaining consciousness. If you become exhausted, take turns with other people nearby. Now, what are the signs of regaining consciousness? This is really important. Signs of regaining consciousness include coughing, opening their eyes, speaking or moving purposefully, starting to breathe normally. Stop CPR if the person regains consciousness. If the person starts to breathe normally but still unconscious, put them in the recovery position and pay attention to their breathing until help arrives. Now, how does CPR help? By performing chest compressions and rescue breaths, you are taking over the role of their heart and lungs, pumping blood and oxygen around their body. Every second counts. Any delay can reduce a person's chance of survival. It's far better to do something than to do nothing at all if you are fearful that your knowledge or abilities aren't 100% complete. Remember, the difference between your doing something and doing nothing could be someone's life. I hope this video was interesting and informative. Thank you for watching.